today we'll be focusing on physical health and we'll be speaking about arthritis.
मैं स्वागत करती हूँ डॉक्टर जील परीन गाला का. She is a physiotherapist with over 13 years of experience. She is also a certified McKenzie expert. Currently, she is working at Illuminating Minds Therapy Center at Mumbai. So, welcome, doctor, to our show.
Thank you so much, Ms. Sonam and Minaz ma'am.
Welcome, Jeel. Thank you for coming to our show. Jeel, I wanted to ask you, what are the common causes of joint pain?
Okay, so let's make it very simple. So basically, age is just an issue of mind over the matter. So if we don't mind the age, it will not matter really. So what I say is normally people feel कि चलो age हो गया है तो pains तो आने ही वाले हैं. But actually that is not the case. What happens is as we all age from outside, like we get wrinkles on our skin, our face gets wrinkled, or additionally we have, the teeth keep falling, all those things keep happening, but they are not really painful. So similarly, we are aging from inside also. And that is why we see a few bone outgrowths hota hai. If you see on the X-ray, doctors will say that maybe the jagah bad gaya, gap bad gaya in the joints. So all those things are very common, but not necessarily that those things will give us a lot of pain. So what actually gives us pain, that we need to understand. So क्या होता है normally कि जब भी कोई stress या strain पड़ता है on a particular joint or a muscle which is weak, तभी जाके हमें पेन होता है. So now we need to understand that it is not a physiological thing कि चलो age हो गया, थोड़ा घिसावा हो गया and all that, then you'll get pain. We'll get pain only when there is some abnormal stress or abnormal strain on the body. And additionally, दूसरा एक कारण है कि maybe we have some deficiencies in the body, or there is some excess like uric acid बढ़ गया या deficiency of calcium है, D3 है, तभी जाके पेन हो सकता है. But those pains are going to be a continuous pain, like morning to night pains. जबकि strain और stress का जो pain होता है, that is going to be during some particular activity or some particular time of the day, which you are going to be worse, and some days you are absolutely fine. So we need to figure out कि कौन सा वाला pain है, and accordingly we can approach a doctor for a medical advice or a therapist for your exercises or what to do for the pain. So that is what we need to understand. There are different causes of pain like this, right?
Okay. How can we prevent joint pain?
Okay, so preventing joint pain is the most easy thing, what I would say, because एक बार pain में घुस गए तो निकलना is a little difficult, but prevention is always a very good thing to do. So I think we will be catering to a lot of people who have already entered pain and some of them who have not luckily entered pain yet. या तो pain होके अभी ठीक हो गए. So I just hope that they never get that pain using the preventive advices. So basically prevention कैसे करना है? So like we said in the causes, pain can happen due to different stress or strains on our body or our joints. So वो stress कभी बनता है जब भी हम prolong कोई गलत posture में बैठ जाते हैं, और जब भी हम ज़्यादा टाइम बैठते हैं, खड़े रहते हैं, walking करते हैं या कोई काम करते हैं जो गलत position में रहता है. So supposedly something falls down on the floor. तो हम सीधा झुक के we pick it up. So what happens is that might cause strain in your back. Or you are walking for long distances, but your spine is not erect. You're slouching and walking. Or basically, some people just say कि मैं सोई थी और मुझे pain आ गया. So what happened? Maybe the bell rang and somebody just got up with a jerk. So that can also cause pain. So हमें क्या करना है? All the movements have to be gradual, a little slow. So basically, maybe when you're lying down, you can just turn to one side and then get up. So that is a step-by-step procedure. कुछ नीचे गिर गया तो bend from your knees rather than going straight from your back. So those postures which will अचानक से give pressure on your joints or your tendons need to be avoided. Additionally, जो अपने joints है which are very liable to pain. Basically, we see that the spine, the knees, the shoulders, and the neck. ज़्यादा करके हम वही cases देखते हैं. So how to prevent those things? Basically, so क्या करना है कि उसके जो muscles है वो पहले से हम strong बना लेते हैं. So they will protect the joint. There will be a very protective procedure. So उसको strong बनाने के लिए again what we think sometimes, as elderly we might be thinking कि अभी ये उम्र में strength बढ़ा के क्या करना है, या फिर what, I don't want to do any bodybuilding as such. But why we are doing the strengthening process is because that is going to protect all our joints. जब भी वो स्टेबिलिटी बना रहेगा तो अपना बैलेंस अच्छा रहेगा. अगेन इट विल सपोर्ट द जॉइंट्स. तो वो जो इन्फ्लेमेटरी प्रोसेस है, जो हम आर्थराइटिस इज बेसिकली वो डरावना टर्म लगता है, बट इट इज बेसिकली ऑल अबाउट सम स्वेलिंग इन द जॉइंट्स. Okay, so we can prevent those joints from getting inflamed. या तो वहाँ पे सूजन आने से हम बचा सकते हैं. So for that the joints have to be the muscles have to be very strong. So वो strengthening process जो होता है, तो अभी strengthening में हम different चीजें use करते हैं, जैसे कि we can use dumbbells or some strengthening procedures like a TheraBand. This is just a simple stretch band which we can use, or we can be using some weight cuffs. घर की चीजें हैं जो वजन वाली है उसको हम यूज कर सकते हैं to increase the strength. So two major things I would strain about is, one is the posture. So correct posture में हम normally क्या बोलते हैं, your neck sits on the shoulder and the shoulder sits on the hips. So वो एक जो characteristic pattern है, अगर वो follow करते हैं during any of the movements, neck on the shoulder, shoulder on the hips, so you will prevent 99% of your injuries. और पीरियोडिक ब्लड टेस्ट है, जो कैल्शियम है, यूरिक एसिड है, और वी कैन डू D3 टेस्टिंग, B12 टेस्टिंग. वो जो पीरियोडिक करना है वो करना है. एंड एडिशनली if you find any problems, compulsorily we have to go to a doctor and seek medical advice. So we are not going to enter the pain phase then. So I think for prevention, 2-3 things what I said are really good. That's going to help us.
So thank you for that tip. I loved that head on the shoulders and shoulders on the hips to remember when walking or for my posture. So what are some remedies or activities that you can suggest for joint pains?
Okay, so basically, again, once we have entered the joint pain, we have to be a little careful, more careful than the preventive phase. So उसमें हम क्या कर सकते हैं कि periodic rest. Okay, that term has to be enlightened. Like a periodic rest to that particular joint would be advised. We do not advise bed rest to any of the patients unless they have entered something like a fracture or something. Fracture होगा तो compulsory जो procedure है 1.5 महीना 3 महीना you have to rest, that is compulsory. But if it is a normal mechanical pain, never a bed rest. More than 3 days is advised. कितना भी खराब pain हो, no bed rest, because that gets into a cycle of not working. And from not working, we get into muscle weakness, and again there is instability and more pain. So we have to break that cycle, definitely. So any episode of pain, people tend to get into that rest phase, and then we enter that vicious cycle. So definitely to break that vicious cycle, we need the help of the therapist or the doctor, and additionally the family also has to intervene. So what we normally do is we have to tell them that what is actually wrong. So maybe on the basis of an X-ray or a lot of patient education is given. कि क्यों pain हो रहा है? Like we talked about the causes. So why have they got the pain? And additionally, what different changes in lifestyle they can do? A lot of lifestyle changes, like not squatting down, not sitting on the floor. All those things can be done, right? So basically, a lot of lifestyle changes, climbing up the stairs has to be avoided, forward bending has to be avoided. So these things are definitely helpful, and the family is definitely going to support us in doing that. So it is a combined approach of the doctors and the family together. Then if any assistive device is required, so to the patient, we can just advise for some time. It might not be a permanent thing. It could be some assistive device like a wheelchair or maybe a stick, normal stick or a walker, which could help them prevent pain for that time and give enough rest to that particular part of the body. Okay, or some braces. Additionally, after that, what we normally do is prescribe them some exercises, basically keep moving exercises, which are not going to strain the joint more, but definitely they are going to increase the muscle strength, increase the proprioception, मतलब joint का जो sensation रहता है वो बढ़ाना है. So all those things will cumulatively increase the longevity of the life of that particular joint. So arthritic pain. So ये हो गया particular joint wise remedy. Overall body health के लिए जो prevent करता है, additionally it will help also. It is different activities, like we can get into some yoga. So yoga would be a low intensity workout, and in the beginning we can do short duration of short pose, some simple poses. And again, enough advice is available from the society. We have yoga instructors also who can help us. So it will maintain the flexibility and the strength both. Then second thing what I would suggest is, if there is exposure to a swimming pool, swimming is the best exercise that we can do. So it is going to be, helping the flexibility. The water will take away the body weight. So definitely वो बिना weight का exercise होता है. So that's not going to give a lot of pains while doing the exercise also. And water will help you use the whole range of motion of your body. Basically वो free movements रहता है. So swimming is definitely a very good exercise if it is possible and you already know it. That's the best thing we can do. Additionally, swimming ke baad, I would say we can even get into some basic walking. Walking is like, the freest exercise. There's no investment in that, easy and accessible. And any time of the day we can do it. So walking, but उसमें एक चीज है कि definitely you have to use comfortable shoes and avoid slopes or gradients. जब भी आपको pain है तो वो नहीं करना है. But walking is the best remedy that we can get into. And last but not the least, one advice I would like to give everybody is listen to your body. Okay. So everybody's body is different. Everybody is going to respond differently to arthritic pain. So what we need to do is stop when you get pain. If we are doing some activity and we are getting into pain, that means we have gone wrong somewhere. और पेन के पहले क्या आता है? See, I just missed it. Sorry. So what happens is pain जब भी होता है ना उसके पहले we get some stiffness or there is some redness, some swelling. So first that is the red signal. When the red light glows, we need to stop. We don't need to actually go till the pain. And at that point of time, we can seek a medical advice again so that we do not enter or land up into pain. So always the red flag which we need to see is the pain के पहले का swelling or the stiffness. So always listen to the body. The body is going to give us the maximum information. Yes. Okay.
Thank you, Dr. Jeel, for the fantastic suggestions and tips. Just to summarize, and the very important point that you mentioned is to listen to your body and notice where the pain is and through which activity. And yes, and the tips and the suggestions that you gave, I'm sure seniors will benefit with them. Thank you so much for being here with us today. And
That's great.
cheers to wellness.
Cheers to wellness.
Cheers to wellness.